Next is the genitourinary diseases which we can see in the old age. So aging brings many changes in this system also. So these changes are urinary incontinence, UTI, chronic renal failure, prostate disease as well as prostate cancer. So here the chronic renal failure may be due to the complications of glomerulonephritis, diabetes mellitus as well as hypertension, which is commonly seen in old age. So prostate disease may be most common one is BPH, and prostate cancer is also seen in old age male patients. So regarding the urinary incontinence, so millions of older adults suffer from this incontinence. So this is just loss of voluntary bladder control. This will create not just means irritation to the person as well as to the caregivers. It also signals an underlying problem. So it should be treated carefully. It should be treated. It should not be treated as a normal sign of aging. So types of incontinence. There are 4 types of incontinence. First one is stress incontinence. That is urine leakage during activities that increases the abdominal pressure. So any activities which increase the abdominal pressure can lead to urine leakage, such as coughing, sneezing, laughing, as well as other physical activity. So why this happen? Normally it doesn't happen. So it results from a weakened anatomic support. So already the old age person's anatomical structure is weakened. This can happen, stress incontinence. So the anatomic support of the pelvic floor may be weakened, or maybe after effect of perinatal trauma or any gynecological trauma during any surgery. So that is about stress incontinence. So coming to the next one, urge incontinence. Urge incontinence is the inability to delay urination with an abrupt and strong desire to void. The person will be having abrupt desire to void, cannot hold the urine, so urinate then and there. So it results from bladder hyperactivity related to bladder hypersensitivity, sometimes due to involuntary bladder contractions. So sometimes it is seen in case of detrusor instability, that is the muscle, detrusor hyperactivity as well as detrusor irritation. So the detrusor irritation commonly occur due to any of the infection, maybe mainly UTI or calculi or related tumor or the obstruction. So that is urge incontinence, the inability of the person to delay the urination. At any cost, the person cannot control the feeling to urinate. So moving to the third one, that is functional incontinence. So in which the lower genitourinary tract is fine, normally functioning. But how it happens? So it results from immobility or cognitive impairment, mainly due to cognitive impairment. So it results from disruption of the continence routine. The routine is being damaged, means not damaged. Routine is not being maintained. Mainly seen in immobility, cognitive impairment, as well as psychological problem. So that is functional incontinence. Coming to the final one, overflow incontinence. So here may be due to the distended bladder that occur in case of incomplete emptying. So incomplete emptying may be occur in cases like psychological problem as well as neurological problem. So these are the 4 types of incontinence. The first one is stress incontinence, urge incontinence, functional incontinence, as well as overflow incontinence. So while taking the health history, the patient may report all these points, all these features: dysuria, urinary hesitancy, urinary frequency, as well as urgency. Sometimes nocturia, hematuria also is being seen. So urinary leakage during laughing, sneezing, as well as coughing. poor or slow urine stream, dribbling, perineal irritation as well as depression. All these complaints can be reported by the person while we are taking the health history. So coming to the nursing diagnosis, so risk for impaired skin integrity related to urinary incontinence. So continuously the urine is going or leaking, so it can lead to impaired skin integrity. Risk is there. So how can we take care? So assess the perineal area for signs and symptoms of any breakdown of the skin. For example, redness. So we can provide proper perineal care. We can use mild soap and warm water to wash those areas. So it will prevent urine odor in one side, and it will prevent the potential breakdown of the epidermal layer. We should apply moisturizing cream as a barrier so that it can act as a protective, it can provide a protective effect. It can prevent the irritation as well as possible breakdown. But inform the most commonly the female persons to avoid using hygienic products or deodorants over those areas. That again, it will lead to increased dryness as well as allergic reactions. And finally, a risk for infection related to urine leakage and indwelling catheter use. So invasive procedure, of course, there will be a risk of infection or urinary tract infection or other problems. So encourage the patient. You can avoid the patient, you can add person or old age person to drink at least 1.5 to 3 liter of fluid daily, so that the stagnation of the urine will not be there. One thing. Second thing, as increase, if we are taking increased amount of fluid, there will be increased excretion of the urine along with microorganisms. So infection can be prevented. We can obtain the urine specimen for urine analysis, as well as we can do a culture so that we can identify what organism is actually causing the infection. So we can ensure effective treatment. And teach the patient and his family about the signs and symptoms of UTI. So early recognition of UTI allows prompt treatment. So long-term catheter use increases the infection risk. So we can check whether the person is able to control the urination. So we can remove the urine catheter. So behavioral technique can be taught, such as habitual voiding, bladder retraining, and kegal exercises. All these things can be taught. So that is all about today. So we have covered 3 areas: cardiovascular, respiratory, as well as genitourinary system. Common problems in old age. Thank you so much.